Thanks so much for joining. We wanted to make sure we left a few minutes for folks to join, but we're going to get started. So just letting my team know that we're going to get started now. We've already started the recording. So welcome, everyone. My name is Leah Romano, and I'm a relationship manager here at Aquifer, and we are excited to present to you our introduction to Aquifer for new users. This webinar will be recorded and sent out to you afterward. So I want to welcome our presenters and panelists in today's discussion. Dr. Sherilyn Smith, our retired and former Chief Academic Officer, will be leading the webinar. She's a professor of pediatrics, University of Washington School of Medicine. We also have Dr. Alyssa Brown, who is a surgery resident at Northwestern University. And then joining me will be Kate Hancock, our other relationship manager here at Aquifer. So today's webinar's learning goals, we're going to provide an overview of Aquifer for new users. We will review the resources available to you and answer your questions. Some logistics. Place your questions in the Q&A, and we will moderate the Q&A at the end of this presentation. Other questions will also be answered in a chat by the staff attending the panel.
Hi, everybody. So glad that you're here today and that I get to talk to you about Aquifer and all of the wonderful educational products that we have that can help you with your students. So a little bit about Aquifer. We're a not-for-profit, and we're dedicated to delivering the best healthcare education through collaborative development and research into high-impact, innovative virtual teaching and learning methods. We've been at it for a long time, and we continue with this great mission. We collaborate with a large number of educational organizations, and some of them are listed here. We span the range from preclinical educators, such as those with IAMC, to all of the clinical disciplines in pediatrics, family medicine, internal medicine, geriatrics, and radiology. We have physician assistant colleagues who are working with us. We have our wonderful osteopathic colleagues, nursing colleagues, and anatomists, biochemists. We're all in this together. And this is just a little snapshot of some of the people who are helping continue to align those national curricula that you saw from our partner organizations with our cases and all of our other educational products. Keep our assessments up to date, keep all of our content up to date, and everybody's working together to make this happen for you. Here are Aquifer courses. These are, you can see the ones listed there by subscription, and I mentioned some of those disciplines as well. We also partner with NYU to bring surgery preparation for practice and addiction medicine. And then we have some free courses as well. You can see social determinants of health, practice for being an excellent diagnostician, high-value care, and even skill development through the oral case presentation module. So why Aquifer? You may be asking this question, and I will say that the educators came together through our collaboration to really focus on clinical reasoning skills. That is at the heart of all of the cases that we use. One of the things that's really important for us is to unpackage how clinicians think and then interweave those great curricula and have students have a safe place to practice. Because we all know that developing clinical reasoning skills, even for early clinical students to later clinical students, is difficult. And particularly in the clinical sessions, it's really hard to create time. So that's why we are here. That's one of the cornerstones of our cases. And the cases walk through the steps of a complete patient encounter. So it really allows the students to practice all of the different types of clinical reasoning that they have, maybe in taking a history, or what parts of the physical exam do they need to focus in on, creating a differential diagnosis, making some decisions about, yes, this is actually the diagnosis, or how am I going to think about this treatment, and then putting it all together in a great management plan that's perfect for the patient. We covered the key clinical conditions to standardize your clinical experiences and then to expand the access to patients that your students may not see because they are in different clinical settings, or maybe it's a different time of year and they just don't see those types of patients. So I'd like to just pause for a second and make sure that you're ready to get started. So first of all, make sure you have access. So did you receive an email from us inviting you to register? You need to register to be able to see some of the great things that I'm going to show you in just a minute. And also orient your faculty. Tell your peers and colleagues that you are going to use Aquifer, that they have access, and that they should look for the same type of email. And then as we provide you new information, make sure to pass it on. So what I'm going to do now is go and show you a little bit about cases and what you can actually get in your Aquifer learning subscription. So what I'd like to do now for you all is to walk you through the whole process of logging in, finding out what's in Aqueduct, our learning platform that you have access to. So up here is the sign in button, so click on that. And that will take you to your registration page. So if you haven't registered, that's where you do it, right down here. And then you just go ahead and sign in. And so once you've signed in, you will end up where what we call the landing page. And this has all of the different types of resources that we're going to go through that you have access to, as well as all the cases. So what I'd like to start with is a little bit of a tour of a case so you can know what to look for, what your students are experiencing, and bring to life some of the things that I talked about in the introduction. So here we're in family medicine. And one of the things that's a little bit different here that you'll see is that you have a different view of the cases than the students do. So just keep that in mind, and I'll highlight some of the differences as we go along. So I'm going to click on family medicine case number 5, one of my favorites. And one of the things that you all need to remember is that these cases are very rich. So they take somewhere between 30 and 45 minutes for a student to complete. And so I would plan about 45 minutes in your curriculum. Some of our cases are a little bit shorter, 20 to 30 minutes, but plan on that 45 minutes. That's perfect for students. The other thing is that the student experience is going to be different than what you see right here. So there is a progressive disclosure. So what you're seeing right now is the faculty view, where you can see all of the elements that the student will work through. They're going to see one page at a time. So they'll just see the introduction. And then once they work through the content, then they'll be able to see the history, the past medical history review, et cetera, et cetera. So just keep that in mind as you are thinking about how the students will use the cases. So you can see that, as I mentioned in the introduction, we really work through all of the elements of the history and physical. So you can see history. I'll come back to the summary statements and differential diagnosis, the physical exam, really thinking about treatment and what care plans might emerge, as well as follow-up visits. So it's this comprehensive case that is really great for the students to see. Some of the other things that are really important for you to know, and it starts right away, they're embedded questions throughout the entire case. And so for this is the introduction, we ask about, what can cause palpitations? And so the students have an opportunity to write their answers. Now, you won't be able to see the answers to these questions because this is a safe learning space for them. But they get great teaching right afterwards. So they submit their answers and then they get an expert comment right away. So there are going to be embedded questions throughout the entire case on all different aspects. We also do a lot of modeling about communication. And so you can see here that this is a question and answer, really helping students understand what are best practices for communication, how to gather data, and then how to remain in a patient-centered manner. So that is also sprinkled throughout all of the cases. One of the things that I really like, and again, linking back to that focus on developing clinical reasoning skills are these two elements, the summary statement and the differential diagnosis. So a summary statement, we ask the students to think back, what do they know about the case so far, synthesize it and put it in a really concise statement. So they write it here. We give them guidelines for what a good summary statement is. And then we model for them what a summary statement should look like, and then point out the key features that they should be paying attention to. You can see along this side over here on your right that students can keep track of things as they go along. And so that's a nice thing to point out to them in the orientation. This summary statement you can actually see in the case reports, and I'm going to show that to you a little bit later. So continuing on the clinical reasoning theme, we ask them to make a differential diagnosis. And so they have to choose the ones that make sense, they get feedback, and then they get amazing teaching about, say, the differential diagnosis of palpitations in this case. Students can bookmark this content if they like and keep track so that they will have their own unique note-taking system throughout the cases. So it's a really great way for them to reinforce their learning. All right, so one of the other things that I'd like to show you is some of our embedded imaging. So in this case, we're talking about the preceptor and the student are talking about the test results and how do you interpret them. Nice question and answer. And then you can see that in our teaching point, you see some really great examples of radiology about thyroid scans. So we try to embed important test results, imaging, things like EKGs, so the students can have some practice interpreting as well as seeing some real images and examples of what tests might also look like. One of the last things, so I've done this, nice overview of what's in the case, and as the students work through, you can see that they get down to the case summary. Now, this is something the students really, really love. So they click Finish Case, and then they can download the case summary. And what the case summary has in it, as this loads up so I can show you, is a synopsis of all the great teaching points in the case. So you could see, remember we talked a little bit about the palpitations, characterization, and etiology. That is right here. So the students have this to study from, to review from. They can take it with them. It's totally awesome. The students actually ask us to do that. And this is something that's also available for you through the educator resources. So you don't have to click through and do all of cases. You can actually get this case summary so you know exactly what the student is doing. And another thing that the students ask for and really also love are the self-assessment questions. So every case has self-assessment questions. Make sure that the students know this. This is after they download the case summary, so they may get all excited and they're like, stop. But there are 5 self-assessment questions for all of our cases that really enforce the learning in the case. So this is an example of the types of self-assessment questions that we have. You can see that it's, again, somebody, in this case, it's linked back to the case, so palpitations, but it's a little bit different. And so really going back to those critical things that the student must know, they have to choose, and then they get the answer comment really very clear about what is important and feedback on their learning. So first of all, one of the things that I'm super excited about is something new that we're offering to our curricular partners, the integrated illness scripts. And so the integrated illness scripts really are focused on helping students leverage basic science knowledge to make better clinical decisions. That's what we're all about, again, that clinical reasoning skill. And so you can see that we have a large number of them. They're on key topics. And what I'd like to do is show you what sort of the anatomy of an integrated illness script is. And so when we open up asthma, you can see these are the elements. And the first is sort of an overview of what is asthma, and then what's the pathophysiologic insult? What went wrong that somebody actually has asthma? And then one of the really cool things is that the students are presented with key symptoms. And this really allows them to think through, like, why does somebody cough if they have asthma? And so they're allowed to really leverage that basic science knowledge. It allows them to pull all of that in, and then it'll allow them to compare and contrast. Like, maybe somebody's coughing, the cough is different if they have chronic lung disease, for instance. This is all linked to the national curriculum from our basic science educators, IAMSI. I would also like to show you the mechanism of disease map. And so here, this is a part of all of the integrated illness scripts. It allows students to think forward and backwards, the way that I think about two different ways of thinking, understanding, say, asthma in this case. From the symptoms, why does somebody have the particular symptoms? That's a wonderful way to tee up why in basic science information is important for students in the preclinical. And then if they know about asthma, then think through all the pathophysiology. So mechanisms of disease maps are a part of all the integrated illness scripts. So just really wonderful. Now, what I like to do now is show you, hopefully you're not getting overwhelmed with all of the content we have. And here's a tool to help you sort through and make sure that you have everything that you want at your fingertips, and it's our content library. So our content library allows you to filter all of our content based on these different criteria, whether it's presenting problems, say palpitations that I showed before, the final diagnosis, hyperthyroidism, for example, or other diagnoses that show up in the case. You can filter by specific courses. So you should say you want to see all of the Aquifer internal medicine cases, you can do that. If you want to do basic science disciplines, molecular biology, it's all right there. Clinical disciplines that go across courses, say women's health, you can look at it that way. Or if you really want to see all of the outpatients possibilities, you can do by clinical location. So that's a fast way for you to find different cases. And then if you are trying to figure out, is this case actually one of the ones that I would like to do, then one of the things, the way that you can do this is go down and look at the synopsis. And it gives you a little synopsis of the case. It talks about the differential diagnosis, and then you can make an informed decision. So to bring this to life and give you an example, let me do a little bit of selection so I can create a custom course. So I'm really interested, so I'm a pediatrician, we're gonna go pediatrics. And then I am really interested in, let's see, gastrointestinal problems, because I'm getting ready for my students to be out in clinic, and it's the winter and it's time for everybody to have diarrhea. So I want to make sure that they can just focus in on these different cases. And so if you want, I want to create a custom course. And so what you just do, so you can add one, or you can add 5 shown, great. And then hit create course. And then we go. And there's my custom course. And so I'll show you what this really looks like after you've identified more in another example as I'm going through reporting. So what I'd like to do now is to show you some of the other resources that you have to help you integrate Aquifer into your course. So I'm going to click on Educator Resources. And you can see that we have educator resources for all of our courses. And so to give you a taste about what's in our educator resources, I'm going to click on pediatrics. And something that is there for every single course, which is super helpful, is an educator guide. So we do have a quick guide that just lists the case, the differential diagnosis, and the final diagnosis. The educator guide gives a more comprehensive overview. And so this is something that you can share with your preceptors. You can download this for a quick reference. You have a table of contents. One of the things that I really like is the case overview. So if you just click on a case, it'll give you the case synopsis, the learning objectives, again, the differential diagnosis, and the final diagnosis. And if there are associated learning activities, you could click right there. If they're available, and many of our courses do have additional teaching approaches that are just perfect and ready for you to use off the shelf. So an example is the pediatric active learning modules. So here are the 4 topics, and each one of these has a facilitator's guide, answer questions for the students, handouts that you need to give them. Everything is ready for you just to take, to read, and then implement with your faculty and your students. So all of these things are available in our educator resources, and they really do help you integrate Aquifer into your curriculum. There are student resources that students can leverage within the cases and in their clinical setting. So these are listed right here. Again, something that you can find on your landing page. So what I'd like to do now, you all, is pull this together, bring it all to life, and show you some really important things about reporting and finding out what your students are doing. And I know that you've probably been wondering about that as I've been talking about all of the things that you can do with Aquifer. So what I'm going to do now is go down to here, this internal medicine rotation block 3. And this is a custom course. So you're going to be able to see a custom course in action. So clicking in here, you can see that we have combined, appendicitis, so some illness scripts here, some high value care, and then some internal medicine cases. And if you're really wondering about how is my student doing with this, you go up to the right and there's the course report button. So I'm going to click on that. And what you can see here is a real nice snapshot of everybody in your course and how they're doing. And so those lovely green checks means the students have completed everything that you've asked them to do. The yellows are in progress, and the reds are they haven't gotten started yet. You can do this both. So going up to the top, you can see this for the cases as well as for the illness scripts. So what I'd like to do now is go down to the student here, Felix Hernandez, and show you what it looks like at the student level. So you can see that Felix hasn't started the high value care, but he's doing a great job with his internal medicine cases. And so nice green check. And remember I mentioned that summary statement? Well, here is his work. And so you can actually see what he wrote. And then right next to it is the expert comment for that. So it's really great to be able to compare and contrast. This is something that you can actually track, follow the students through, and see how they're doing. So I know I've covered a lot, and if there are things that you don't remember or you get started and you're just like, what? There's this wonderful need help button that appears in Aqueduct. So you'll be able to find it, and it's going to pop up in your reporting or in the cases wherever you are navigating. And so if you have questions about getting started or how do I make a custom course, please realize that we have a lot of material here to really get you started going forward. And if you really get stuck, we're here to help you. Just reach out to our support and we'll make sure that you have the best experience you can from Aquifer. And so what I'd like to do now is we're going to go back and talk about some best practices for integrating Aquifer into your courses. So we have gained and learned so much from you all throughout the last many years about some of the best practices and strategies for using Aquifer in different courses. We started and continue to think about Aquifer as a really important tool to supplement clinical experiences. Now, you can assign them as key cases during your rotations. Those don't miss diagnoses. You can have students, or you can select for students cases that might fill some gaps. And so you know, based on the time of year, your clinical setting, that perhaps students will not be able to see key diagnoses. And then you can also link all of these to didactics, case discussion, group activities, really to have an equal learning platform and starting place for everybody to engage in great discussion during your course. You can also use these to help students prepare for clinic. And this can start before they ever get to the clinic. So in your preclinical courses, to provide them that very valuable clinical context. Use as part of a clinical year orientation to highlight important aspects that may be unique to a particular setting. Prep for rotations or key cases in the rotations. I assign the pediatric well child care cases to students at the very beginning of their outpatient rotation, so they have an idea about like what the heck is a well child visit. And specific cases or patients, you can target those particular things. I have curated them, and for inpatient rotations having to do with pulmonary patients, you can assign those cases. And then flipping it around, these can be part of a boot camp at the end of training to help them revisit important topics. I think of Aquifer as standardized patients. You can use this as a platform to jump off for clinical skills training as outlined here. Writing SOAP notes, we've talked to people using these as part of a telehealth curriculum, so many different opportunities. I also use these for remediation. So these are customizable. So depending on what what you need to work on with your student, I think that figuring out which cases are important, whether it's a knowledge deficit, a clinical reasoning deficit, you just want to do a little diagnostic, you can use that custom course function that I talked to you about, and then have them work through the cases and then debrief them. You can use Aquifer exams in your curriculum as well, the multiple choice exams from family medicine, pediatrics, or radiology. We have a really very neat clinical decision-making exam that's for Aquifer internal medicine, so focused on adult patients. We have a formative assessment strategy that's in development that will allow progress testing. And as I said, that you can review the summary statements and build your own sort of deliverables around your cases. Using integrated illness scripts, I've alluded to some of these before, and you can integrate them in case-based learning. They can be study guides, and they provide some clinical context to the basic science courses. So what I'd like to do now is turn the mic over to Alyssa Brown, who's going to talk about some tips for students about using Aquifer.
Hi, my name is Alyssa Brown, and I am an MD PhD student at University of Louisville School of Medicine and Mayo Clinic School of Biomedical Sciences. I'm on the student advisory committee here at Aquifer, and I really joined because I thought that Aquifer was a great tool for students that often seemed underutilized. I thought I learned a lot from Aquifer cases on how to present my patient, what questions to ask, and what things I was kind of missing, especially at the start of third year when I was not quite ready to be in the clerkship setting, even though I was super excited to be there. So it's really important to take the time to orient your students to how to use Aquifer to really get the most out of it. You can take the time to explain why you're assigning Aquifer and then what you expect students to get out of it. It can be really helpful at the start of your course or at clerkship orientation to bring up Aquifer or maybe go through a case together. And that way it shows the students how it can be used and what they can get out of it. I know this would have helped me a lot when I was starting out. You can also explain the value or how you best see this fitting into your course or clerkship. So maybe going through how to take notes on it or how to best use the resources that Aquifer has to offer. Aquifer has a lot of tools to help you and to help students. So it can really be a great tool to help your clerkship or course. So you can link these cases to other learning. That's a really great way to make this a better experience for everyone. Otherwise, it seems like a standalone or just another assignment. So if you can integrate this and connect the students and the cases to why this is relevant to their other learning experiences, it can really be a great step towards using and getting the most out of this. So some of the ways that these could be connected are being used as preparation for a lecture or discussion. You could use this as a way to have a presentation or prep for a patient in clinic, or you can review concepts or a knowledge gap overall. So you can really ask the students how these cases are going instead of having them as a separate learning experience. In that vein, keeping the assignments manageable. In medicine, we often say like drinking from the fire hose, and that is true, but just dropping one large block of cases to complete to these students can be a little overloading. And it can make it to where students just click through these cases instead of really learning and taking the time to learn from these cases. So if you can either assign them throughout the course, so a certain amount are due by each point, so they're more spaced out, allowing time for the completion of the cases. So these cases are about 45 minutes or even longer if you're really taking the time to look through them. So understanding that that may not be manageable to all students if they're on a heavier rotation, or kind of spreading them out and keeping it as manageable as possible. Also potentially targeting case assignments for key conditions, or even about lessons you would like the students to learn, or maybe conditions they are likely to not see. Assign early. So this is also kind of in that same vein. So the cases are valuable in preparing for the clinic. So consider assigning them in preclinical courses to provide clinical context. I really always loved shadowing during my medical school preclinical years because it gave me context for what I was learning. I think these cases could be a really great way to provide context for preclinical students to kind of get a flavor and a feel for what they're going to actually see in those clinical years. Because as a student, you crave those clinical experiences. You went to school to be in the clinic. So this could really be a great way to bolster that education. So these could be done before rotations or in clinical years, early in the clinical years, to build confidence of what questions to ask. How are these situations managed? And also Aquifer does a great job of integrating and adding in really important public health information, as well as really good tips about how to discuss different conditions and different situations with patients. So having these early in clinical courses to cover key conditions can really prime for a patient and really help the students feel comfortable in the clinical setting.
Welcome, everybody. So thank you for attending the webinar. Again, for those who've joined later, I am Leah Romano, a relationship manager here at Aquifer, and joining me on this panel is the other relationship manager here at Aquifer, Kate Hancock.
Hello.
We are here to answer your questions. So please feel free to use the Q&A box or the chat box and enter your questions there, and we'll make sure we answer them. And as we are waiting for you to fill in those chat or Q&A boxes, we can get started. So we noticed that some of you who, when you filled out your registration, you had indicated some questions of overview, what about the platform? And we hope the webinar answered those questions, but we can also just share some additional information. So we can share the screen. And Kate, would you like to start with your, fan favorites of whether it's just an overview or your top tools?
Definitely. Hi everyone. I'm really pleased to actually see all your names. I haven't seen you yet, but I really hope you enjoyed Dr. Smith's overview and Dr. Brown. Dr. Brown, as you probably saw in the introduction, is now a first-year surgical resident at Northwestern. She is an MD, PhD, which is very impressive. We serve an incredible array of programs, and one of the things, there's two things that I really want programs to know when they're beginning using Aquifer, is to really take advantage of the content library. And Dr. Smith talked about this a little bit, but I wanted to emphasize a couple things, because I have just come back from PAEA in San Diego, and I was deeply impressed by the number of folks who came up and talked about how their teaching and learning is system-based. So one of the options in our content library, which I think really allows you to unlock the potential of Aquifer, because every program is unique. I feel very strongly that the system filter could be really, really helpful. So when you go in here, it's very easy to look at presenting problem, final diagnosis, additional diagnosis, or go straight to the search box. But I encourage you also to explore the filter options here, and especially the system based filter, which is actually very, very powerful. And as Dr. Smith said, there's lots of options from here. You can create, custom courses and whatnot. But I do encourage you to, as I said, unlock Aquifer this way. The second thing I wanted to emphasize, and this is again something that Leah, I know, and I talk about all the time, whether it's on the phone or on a Zoom or any kind of interaction at a conference, is the power of our website. There are tools and resources within Aqueduct, which is firewalled, and faculty and staff see certain things and students see certain things. But we have a very, very powerful website, which is constantly being updated. And under our resources tab, you have getting started, our support resources, making the most of your subscription, but also orienting your students, which Alyssa covered very, very well. But I always like to take people to our blog here, because there are lots of different ways to filter within the resources. But we've recently had an update. So you have a lot of filter capability on the left-hand side, because we know you are busy. And you could, for instance, go here and let's say, I want to learn more about preparing for clinic because I really want my students to be confident. You can click here and you take all the best and brightest options, whether it's a podcast, a webinar, or a blog post is pulled up for you. And this really is where our community comes together and shares with each other. Aquifer would not exist without our consortium of medical and osteopathic and PA and nurse practitioner educators, but they truly believe in not reinventing the wheel, and they share generously. And so you have lots of options here. Again, if you're a PA program, you could filter, and you can see very quickly lots of, oops, it didn't filter. Let me go back. You see lots of really, really salient information, and you can just click through and learn from your peers, or learn from a colleague. Maybe you didn't realize that a colleague was sharing their resources and tools on the Aquifer website. But those are things that I really wanted to emphasize while you're here. And Leah, is there anything you wanted to add since I have the screen up?
Yeah, since you have the screen up, I think some of the things, if you go back to resources and just hover over that for a moment, that all of them are listed not only here, but within Aqueduct. So and we'll show you where you can find them. So you can access these links. They're referenced within Aqueduct. In addition to the resource directory, which is a really great tool for you to pick and get some tips for and by your peers. If you're just getting started, or I know this is the time of year as well, people are thinking, what's in my subscription? Making the most of your subscription is a really great tool, because it highlights what comes with your subscription. And then when you log into your Aqueduct account in the teaching and learning system called Aqueduct, you will see the courses that you have access to. And though we focused most of this webinar on Aquifer courses, those of you that subscribe, Kate, if you want to hover over courses for a moment.
Oh, sorry.
Those of you that may subscribe to our partner courses, such as WISE MD Surgery, WISE On-Call Readiness for Practice, Care Addiction, there's some additional information on those course pages. We don't have to click on it here, but there's additional information there to help you with educator guides and things of that nature. So we have a rich history of putting together resources for you. Kate, if you can go back to Aqueduct, some of my fan favorites, which Dr. Smith highlighted, but we can stay on this page.
Okay.
In addition to the system, Kate did a really great job, but if you can click on clinical disciplines, this is another one that I like to highlight too. A lot of folks ask us, do you have a course on X? Well, we may not have a course with that direct title, but we may have some cases with that language. So in addition to system or a keyword search, clinical disciplines is the area that has some content that doesn't have a match of a course title. For example, psychiatry, or there's neurology, currently OBG, and then surgery that's not connected with the WISE-MD content. So just wanted to highlight that drop down. And then, of course, you can see on the screen the Need Help button on the bottom right that's available to faculty, staff, and students, and the information is curated by your user role. Kate, if you could go to the courses page by clicking on in the header, clicking on courses. This is what, when Dr. Smith was saying, your dashboard. Once you sign in, there is a dashboard that loads, but if you want to see all the courses, you can always click on courses to refresh. At the top of the page, that's where the dive-in orientation for faculty and staff is. That's where the illness scripts, should you subscribe to it, educator and student resources are listed based on your user role. And the dive-in is a self-directed orientation for faculty and staff, and all the hyperlinks that Kate and I were referencing are there. So if you only use the Aqueduct system, just know that the dive-in has what you need, and the Need Help can help you find it.
Leah, if I may, I'd like to add one more thing, and that is, again, having just come back from PAEA and having, in March I was at AUR and I spoke directly with radiologists, and in San Diego speaking directly with PAs, PA educators, staff from those programs. One of the things that kept coming up was the fact that we have free content that is very powerful and very helpful. So I'd like to go back briefly to the content library.
Sure.
And show folks our high value care course, because a lot of folks are very focused on the clinical setting. And when you think about the clinical setting and preparing for clinical setting, we tend to think about along disciplinary lines, but some of the courses that can really help you include high value care, diagnostic excellence, oral presentation skills. These are really excellent introductions. And right there you see high value care, the importance of clinical reasoning. These are cases that you can assign, for instance, if you have a month break between your didactics and the beginning of your clinical rotations, and students can really familiarize themselves with the world that they're entering. And there's lots of excellent cases here, but also within our educator resources, even though high value care is a free course, we have excellent tools and resources within our educator resources. So there's a real depth and breadth to our offerings, and we really encourage you to explore. We know you don't have a lot of time, but if you can, please take time to explore. I think you'll be pleasantly surprised.
Thanks, Kate. Staying on this, can you go to the pediatrics educator resources for a moment?
Sure.
So we gave a really good overview of what comes in here. If you were to click on the educator guide, these are about 40-page documents. Kate, if you can scroll to the end where in the end of the educator guide, it provides a case description of every case, what synopsis and learning objectives. All of these things are pop-up windows if you were in the content library. But one of the things I enjoy about this, and if you like looking at PDFs or printing them out, Kate's scrolling through like the first 20 pages, which gives the background and everything. Kate, you can stop on any page that has a yellow sticky note. So much of this information, like the case synopsis, the location, the objectives, that's already in the content library. And as we are constantly making updates in our system, one of my favorite aspects of the educator guide is that little quote unquote sticky note on the bottom of the page, because it tells you if this is the case you're interested in teaching, these are the learning objectives that map with it. And we are making adjustments in our system to make that as an output within our system. But for now, if you're looking to how do I integrate, how do I use everything that comes with my subscription, the educator guide does in the back list what activities come with what case. And this is also a great opportunity to click on a corresponding blog or webinar that shows the best tips of how to do that. So this is another handy tip that we hope that helps you. Kate, one of the questions that came in the registration was asking, tell us what's new with Aquifer. And there is more that what's new than what was presented in this webinar. So do you want to kick it off and say what's new for either curricular partners or those who aren't curricular partners?
Sure. Sample University that we have up here, it's a FERPA compliant, account. It includes it is a model curricular partner a program. It has all 5 Aquifer courses, so family medicine, internal medicine, pediatrics, radiology, and geriatrics. And if you're a curricular partner in the current academic and fiscal year, you also have access to excellence in palliative care, which we are thrilled to offer, as well as trauma-informed care. And those are both very exciting courses that we have. And then we are very pleased to let folks know that if you are a curricular partner as of July 1, 2023, you will also have at no additional charge our neurology course, which is in the process of being written now. We are very, very, very excited to be offering neurology. For many years, we've offered the filter within the content library, but we have not had dedicated written by neurologists cases. We have excellent cases within geriatrics, but not a dedicated neurology course, and that will be available for our curricular partners on July 1, 2023. Am I forgetting anything, Leah? Assessment. Yes. Thank you very much. I'm so glad you're here. Let me close a couple things and then go back to our website. And that is Aquifer has for many years offered 4 summative assessments, one for family medicine, one for pediatrics, one for radiology, and then a rather unique internal medicine exam known as the clinical decision-making exam. On June 30th of next year, we will sunset 3 of those 4. So family medicine, pediatrics, and radiology all will be sunsetted. Our clinical decision-making exam will continue. Again, it is a very innovative exam. And we are currently this year, after many, many years of work, piloting with select programs, our new formative assessment, which is Aquifer Calibrate. And this is currently available to our pilot schools who are curricular partners this year. And we're very pleased to let folks know that we anticipate that on July 1 of next year, you will not have to be a curricular partner in order, for instance, to have the Calibrate for family medicine or pediatrics or radiology or internal medicine. This is a very innovative new assessment. We're very, very excited about it. The idea is to have an early assessment launched from within Aqueduct, so no more proctoring if you are a current subscriber and know about our proctoring requirement, and then a second assessment later on in your clinical rotation or clerkship, where a student will get a second snapshot of where they are, what their strengths and weaknesses are, their confidence level. It's very innovative. We're very excited about it. If you want to learn more, please go to the Aquifer website, go to assessment, and go to Calibrate. We have excellent tools and resources, as well as videos, some of them quite extended, where you can have a complete overview of this new initiative.
Thank you, Kate.
Yes.
And then in addition to that, and just wrapping up, because I don't see any questions in the Q&A or the chat, just letting you know that as part of our directory, our educator directory, we're constantly adding new tools and updates that we make available to our subscribers that would be listed in our educator to educator directory. And we really keep in mind our audiences and our users and who they represent and what they want. And we list who our contributors are. And so it's not just a community of receiving information. If there's a story you'd like to share or a tool that you're using that you really think maybe could be added to our directory, we have buttons on those pages where you can join and be a part of the community and sharing your knowledge. So just letting you know that there's a wealth of information available to you. We hope that you dive in and just enjoy using Aquifer. And we are here to help. So I'm looking at the time. There's no extra questions. So we can go to the next slide to let you know about just wrapping up. So if you do need to talk, if you have questions from what we've mentioned or just more questions, know that Kate and I are available. Our information is listed here. If you'd like to speak with a peer, we do have peer consultations available, and you can just click on that link, fill out the form. And then if you have general questions and want to just get another orientation onboarding again, you can certainly write to Kate or myself. We also have a general email that we can type in the chat right now. Kate, if you can do that while I'm talking, that'd be awesome.
Sure.
Subscriptions, and that will come to our customer success team, and we can make sure another orientation call for either you or a larger portion of your team is available, and we can go more in depth and help you there. And Kate's going to put that in the chat so you have it. Thank you, Kate. And then lastly, if you'd like to connect with us on social media, we are on Twitter and LinkedIn, and we would love for you to connect. We hope that this has been a helpful webinar for you, and we look forward to working with you. Thank you for choosing Aquifer, and enjoy the rest of your day.